Well, I think it all comes back to our mission, most trusted health partner. How do we keep earning that trust? We keep earning that trust by being at the forefront of those advances in medicine, bringing them to bear responsibly, but in the capable hands of all of our clinicians. That's critically important. And then also adopting other technologies that we bring to bear to assist our physicians, our nurses, all of our clinical staff, really advance those patient experiences, improve them, improve that quality. And we're always focused on those ways that we can improve those patient outcomes and the patient experience along the way. So in surgery, volume is a critical element. So as surgeons do more and more volume in a particular procedure, that quality continues to get better and better. And nobody does more volume in robotic joint replacements than South County Health and Ortho, Rhode Island. And so patients coming to see our partners at Ortho, Rhode Island can be confident that not only the surgeons that are doing the case, but the nurses and the anesthesiologists and everyone involved in the case understands how to do a robotic joint replacement. And so when you've done almost 24,000 robotic joint replacements, you're coming to a center of excellence, a high volume center that is going to have extraordinary outcomes and extraordinary capabilities. The team is all going to be working together to give a better quality product and a better outcome. Yeah, I'd say the best example that I can think of is the 9,000th patient that we had. So the 9,000th patient was a patient of Dr. Marchand's, who took it upon himself, I think within 24 hours, to go take a video of himself shooting a basketball, shooting a free throw, and to think how far things have come where someone within 24 hours is shooting a free throw on a newly minted joint replacement. That tells you how far the technology's come. So we're extraordinarily blessed to have an outstanding partnership with such a wonderful and progressive group of orthopedists who 15 years ago came to us, and really before my time, with the foresight really to see that the future of orthopedic joint replacement was in robotics. And so that early adoption of that technology is just one example of many in which our partners are progressive. They're focused on the most advanced technology, but also focused on what South County Health is consistently focused on, which is extraordinary quality, extraordinary patient experiences, and extraordinary outcomes. So one of our focus areas, one of our key strategic initiatives as an organization is transformation. Healthcare is not static. Healthcare is not standing still. Technology evolves rapidly, data evolves rapidly. All of the clinical capabilities surrounding the intersection of that clinical technology and capability, as well as data, come together best when you have partners that understand what to adopt, what not to adopt. And really that is our focus, our relentless focus at South County Health, which is how do we pursue better outcomes, better patient experiences, advancements in care that are going to lead to fulfilling our mission, which is being that most trusted health partner for all Rhode Islanders. So Mako and other robotic technologies are continuing to advance their capabilities around customization. Obviously, we are in the age of artificial intelligence, augmented intelligence, and so how do these robots help our physicians learn faster, better, assimilate large volumes of data to make each successive procedure better? South County Health was the first in New England to adopt the latest in Mako technology, And these coming iterations of technology is going to integrate that artificial intelligence, that augmented intelligence, to better use all of the data that has been collected in these procedures over the years. There are going to be new applications, as I understand it. So right now we have the partial knee replacement, we have the total knee replacement, and then we have the total hip replacement. I believe coming in the near future is a total shoulder replacement. And then I know Mako and Stryker are always looking at opportunities to expand this technology to other joint reconstruction efforts. And so those are the things that are to come. I think it's really looking, we always look, just like we did 15 years ago when we looked at Mako technology. We always are looking for technologies that help us to advance the clinical care that we give in a community setting, whether it be robotic joint replacements, robotic-assisted urologic procedures like we've done with aquablation, and then really there is the augmentation of big data. And so how do we look at big data, large data sets that any human couldn't really rationalize, but how do we look at that data, understand that data in those large language models, bring it together, and then help our clinicians find better algorithms, better treatment patterns to then complement all of the technology that we're bringing to bear on these patient experiences. That's really where I think the future of medicine is going. So I want to offer a special congratulations to Dr. Bob Marchand for completing his 10,000th robotic joint replacement. Dr. Marchand was a pioneer of this technology here and really is a legend in this state and really nationally and globally. We're so privileged to work with someone of his caliber and all of his colleagues for all of the outstanding work that they've done in adopting this technology and then moving it forward to bring this service to Rhode Island is truly extraordinary, and on behalf of the leadership and the board, we're extraordinarily grateful.